Hello and welcome. This is Borno Restoration. I am Jesse Tafida. Today on the program, we will track down efforts by Governor Babagana Zulum in improving healthcare delivery to the people of Borno State. This sector is one of the priorities of the Zulum's 10-pact development agenda of the state. Gathered here are present and past APC chairmen, councillors, ward leaders, and party stalwarts. They are here to discuss how best to canvass votes for the APC in the general election. Organizer of the meeting, Babagana Tijani Banki, notes that with Asiwaju Bola Tinubu as the flag bearer of the party, APC will win all positions without doubt. He adds that the people of the state are proud to have produced the vice presidential candidate, Kashim Shettima, who is vibrant and can deliver millions of votes for the party.
What are you supposed to do as a member of the party? You have to look for a way to at least let your party to win. So that is what we did actually. So as for our concern, what we now talk to them, they will really understand, and they are the grassroots people. Particularly councillors are the grassroots people. So we explain to them, we are from the parliamentarian committee. We are only working for the APC, and we want every candidate of the APC to win the election. Asuwaju to town councillors.
The state governor, Babagana Zulum, is represented at this meeting by Senator Abba Aji. He appreciates support of party stalwarts in upholding the glory of the APC.
They constitute the political grassroots of Borno. That's why we value this interaction that we're having with them, and they are the custodians of the wards, all the 312 wards that we have in Borno State. And we have interacted with them tonight, and we are very confident that they will go back to their wards and take charge so that we produce more than the 93% that we have given Buhari in 2015.
Party supporters from the 27 local councils expressed readiness to canvass votes for APC in the forthcoming election. In August 2019, exactly 3 months after the inauguration of the executive governor of Borno State, Professor Babagana Zulum, he assented to a bill establishing the Borno State Contributory Healthcare Management Agency and later appoint the pioneer executive secretary, Dr. Saleh Abba Kaza, young and dedicated person who has been doing a lot in helping the vulnerable people of Borno access to health care through a new program known as the Zulum Special Health Intervention Program. Take a listen.
We have a very important program we are actually promoting, which is the Zulum Special Health Intervention Program. This intervention health program is actually meant for vulnerable citizens of Borno State. And amongst the vulnerable, we are concentrating on about 5 categories of vulnerability. One is the pregnant women, children below the age of 5, that is under 5 children. Then we have the people living with disability. We have the elderly people or the aged, and then the poorest of the poor, among others. And then we also have another category, which is actually we used to tag as those people with special needs. These are 5 categories of individuals or vulnerable people that we are actually concentrating. The Zulum Special Health Intervention Program is from His Excellency. Actually, it is out of his own passion towards healthcare that he made this funding available. And from our take-up, he was able to release 100 million to the agency, so that the agency could do some of those activities, including disease activities. And out of this funding is what we have been using for the past 2 years to ensure that those things have been taken care of. And then other sources of funding that we are expecting is actually from the philanthropists, so that they can also key into this program, and then so that we can actually maintain the program from rolling. Facilities which we have highlighted, or which we have enlightened about the Z-ship that used to identify those individuals, and then they forward their request to intervene as such. So this is how we used to do these selections, and after that has been done from the facility level, from the healthcare workers, so our agents there in the agency, that is the BOSHMA agents there in our agency, used to go to actually verify and validate whether this person is actually needing such intervention or not. And why we do this is because the needs are actually enormous, while the resources are scarce, we know. So no matter how much you have injected into such society with this margin of vulnerability, or this margin of poor people that we are saying about 73% of them, you find out that your resources may not actually go around. And that was why we have to identify, even among the poor, we have to identify those that are in very, very need, in real need of such intervention.
biyar ina ta shan wahala har yanzu ina zuwa asibiti, kuma alhali bana da gata. Na yi wannan ma da kyar aka taimake ni ma ba hannu a wajen. Ni ina kasuwa ne, na sai da magunguna kemis, bana da komai. Yanzu komai harka ya tsaya cak, ban da wahala ba komai a kai wajen. Kasuwa ya tsaya cak, yau shekara 5 da wani abu, kasuwa ya tsaya cak. To ba na da dama zuwa yi, ba na iya tashi, ba na iya zo na kasuwan ma ya tsaya. Amma inda hali in na samu dan canji, zan iya bude kasuwa din, ko ina zama kasa ma zan iya samu abin da zan ci da yalina. A ga yalina suna kara su bayan zuwa hakan a kuka. Yau wata 5 suka zo daga kwalofata, su ma ba su samu abinci ba, haka suke su. Na da mata 3, yara na 19.
Yaron ya yi rashin lafiya da dama, kuma yau at least yana asibiti ya kai kwana 40, zuwa wata 2 da yake nema yanzu. Kwana 40 ne tun a sallah, gobe sallah ne muka yi masa operation, amma bai samu lafiyan ba har yau, kuma yanzu karfinmu ya kare.
For the people, we covered the basic health needs for those people, and in some cases we even go beyond just covering their drugs and then other related hospital bills like their bed fee and other things like that. We even go beyond looking for to source for funds for them, even for their feeding, and because as they stay in hospital, definitely they need to actually feed themselves, and those individuals are people that don't even have transport money to even transport themselves from their houses down to the hospitals. And that was why you see a lot of them cooking within the hospital premises, so that at least they will have something to eat, to give to the patient to eat, and also for them to also eat and other things like that. And it is very, very inconvenient for them. So as such, and then another thing is that those people that usually used to stay that long in hospitals, you find out that even after they are discharged, they end up maybe losing their jobs, or they end up being uprooted from their usual means of livelihood. So before they go, so those people, sometimes they may need some therapy. It might be occupational therapy. Among the other classes of people that we also identify are those people that are orphans, and those people that we used to call them the unaccompanied children as well. The unaccompanied children is because of the a decade-long insurgency, which is about 12 years now in the 13th year. You realize that we have a very large number of population that has been displaced, which was around getting to about 2 million or more in people, including the children. And as such, there are among them those unaccompanied children and those orphans among them, which may also need such intervention. And we also have those people that have mental disabilities. Sometimes you will see a lot of people roaming about the street because of mental illness, and then their families could not be identified or so. So we also intervene in such cases if we identify such individuals, and then we will see how we can even get the care, the necessary care that they needed, and also to help them trace their families. And we do that in collaboration with many stakeholders, including the civil society organizations, not only the government apparatus, but also the private apparatus as well as the community.
Sunana Abubakar Muhammad, ina anguwan Budim, yanzu haka ina cikin General Hospital. Da farko zan yi godiya a Boshma wanda ta dauki nauyin in mana aiki na tiyata da sauran magunguna. Na gode masa da ma'aikatansa gaba daya. Kuma a gaskiya yanzu mun samu lafiya, muna ganin aikin da aka yi na yanzu an dace, kuma alhamdulillah yaro ya dan samu lafiya, yana maganansa, yana neman har sauran, yana neman a bashi abinci ma ya ci, amma da yake yanzu ba zai yi ba, sai doktoci sun faɗa cewa mu bashi abu, za mu bashi. Yanzu ya dauki tsohon kwana 2 da wani abu, an masa aiki, alhamdulillah. Mun gode ya Boshma.
Rashin kuɗin ne ya sa ba mana aiki da wuri ba, amma to yanzu mun samu an mana tallafi, an taimaka, yanzu mun samu aiki. Na gode Allah ya saka wanda ya mana wannan abun, muna mishi godiya sosai.
Victim of gunshot injury, where there's some bone loss, and he had multiple fractures on his his left thigh and hip. So he had an initial surgery in Dala where he spent a lot of money, but the fracture did not unite. So he had to come back here. And luckily, Boshma came in to help him. He had surgery. He had a series of surgeries here, about the third one. So what we are trying to do now is to unite the bone and elongate the bone because the leg is shorter. So we are trying to equalize the length of the left leg so that it will be the same with the opposite one. That is so far what has happened. A lot of things could have happened, as simple as losing the limb from infection to losing his life, actually, because infection of the bone is a very serious thing. It can lead to severe sepsis that may lead to end of life to a patient, actually. I saw him this afternoon. He's doing very well. The elongation is progressing and he's gaining length every day. He's doing very well. He's happy.
Ina godiya ga Allah sarki Ubangiji da bayan da aka yi mana tiyata biyu. Ina godiya yanzu jikina din akwai soki. Mun aiki da yanzu din akwai bambanci har ina iya soka ina tattakawa ina ta adjust din duk akwai soki alhamdulillah. Baba Umar Zulum, Allah ya sa Ubangiji ya tabbatar mana da alheri. Ina godiya sosai da zuwan da muka haɗu da Boschman da Dr. Salen da ya zo ya haɗa mu duka gaba daya. Ina murna ina taya ku godiya.
It's actually very useful, but it's equally very expensive. Orthopedic surgeries are actually very expensive, so this is where this kind of schemes like the contributory healthcare scheme comes into play. And I call on the general public, those that really have the means. There are a lot of such patients outside that could not access this kind of care because of lack of funds. So philanthropists can come in, sponsor such patients. It will go a long way. This is a man that has 3 wives before now, but now he's living in an IDP camp and it's not his making. This can happen to anybody. That is my call, actually.
Yanzu wannan dai da ya same ni yau shekara guda kenan, daga ƙaiƙayin ciwon ido kuma shi kenan sai hazo ya shiga. Da wannan ne yake ciwo kuma wannan ma ya karba, yanzu duk bana gani gaba ɗaya. To shi ne zan ce wannan dai sai dai Allah ya saka muku da alkhairi, Allah ya sa race.
Assalamu alaikum, ni da sunana Aisha Ibrahim, mahaifiyata sunanta Rabi Abdullahi. Yau shekara ɗaya baya ba ta da lafiyar ido. Mun zo ganin likita yanzu akan a ga lafiyar idonta, an duba an ce aiki za a yi mata. To an sa hannu akan za a yi mana aikin kyauta. Allah ya saka da alkhairi, mun gode, Allah ya biya, Allah ya taimaka, Allah ya sa a dade ana yi, Allah ya ba ta lafiya ita.
The condition of the patient is cataract blind. And as we all know that cataract is simply a cloudiness of the lens inside the eye, which is supposed to make you see clearly. And one of the most common cause of blindness worldwide is cataract. And blindness due to cataract is reversible, in that by simply extracting that cloudy lens and replacing it with a clear artificial lens, vision is restored. And the aim of taking her for surgery is to restore the vision of the patient. The most common cause of cataract is age-related. That is due to aging. So, because the higher percentage of the cataract blind are the aged ones, and they are not economically productive, actually. And one of the barriers to uptake of going for this procedure, looking for medical attention so that you get your vision restored. One of the barriers is the cost. So most of them cannot afford it. So we're really grateful, we're happy to see that Boschma has intervened this time around to take up the responsibility of the cost so that this patient can have his vision restored.
One major issue that we are facing in Borno State is that we have a larger number of people that are not covered by any health insurance scheme or contributory health scheme. More than 90% of the individuals in Borno State, or even getting to about 95% of the people in Borno State, are not insured by health insurance coverage. And even the registration at the contributory health care level is a bit very, very low. So as such, we are using also this medium to sensitize people that taking care of the health care, they have to actually change their health seeking behavior to a very positive one, because health is wealth, and without health we cannot develop. To ensure the smooth operationalization of this program, the agency is working alongside stakeholders, especially the Ministry of Health, which is the mother ministry, and then the State Primary Healthcare Development Agency, as well as the Hospital Management Board, with a 10-packed agenda of His Excellency Professor Babagana Umar Zulum, CON, MNI, FNSC, and at the same time the 25.
And that's our package on this episode of Borno Restoration. Thanks for watching. I am Jesse Tafida. See you next time. Bye-bye.